In this lecture, we are going to discuss Monobactam, the most important antibiotics against the gram-negative bacteria. So let's get started. First of all, we will discuss the mechanism of the Monobactam. Monobactam actually inhibit the synthesis of the peptidoglycan, the most important component of the bacterial cell wall. So if you look here, this whole structure is actually the cell wall, and next you will see the presence of the cell membrane of the bacteria. We will see how Monobactam actually inhibit the synthesis of the peptidoglycan. So peptidoglycan has two components. First one is the glycan chain. Here is the glycan chain 1, and after that you will see the glycan chain 2. And in the glycan chain, you will see the NAG-NAM, N-acetyl glucosamine and acetylmuramic acid. Okay. Alternatively, these N-acetyl glucosamine and acetylmuramic acid present in the glycan chain. And after that, at the NAM side, you will see the presence of the tetrapeptide. Tetrapeptide. These are basically the amino acid. Similarly, at that side, you will also see the tetrapeptide. Okay. In between them, you will see the different amino acid, interbridge peptide. Okay. Here is the interbridge peptide. Okay. So, you will see the linkage of the interbridge peptide with the tetrapeptide with the help of the enzyme, that is transpeptidase, or you can say penicillin binding protein 3. Okay, so that enzyme is basically this one. This is actually the penicillin binding protein, or you can say transpeptidase. That enzyme actually help in the linkage of the interbridge peptide with the tetrapeptide. So now you will see the linkage of the interbridge peptide with the tetrapeptide, and ultimately you will see the strength of the peptidoglycan. But Monobactam, if I say, here is the Monobactam. Monobactam basically inhibit this enzyme, that is penicillin binding protein. Okay, if you see the inhibition of this enzyme, then there will be the no linkage of the interbridge peptide with the tetrapeptide, and ultimately you will see the disintegrations of the peptidoglycan, and after that you will see the killing of the bacteria. So it means that Monobactam is actually bactericidal antibiotic. But certain bacteria develop resistance against the drug by producing an enzyme, that is beta lactamase. So that enzyme here, this one, that is actually the beta lactamase. But important thing which you have to remember about the Monobactam, Monobactam has low affinity for the beta lactamase. It means that beta lactamase has low activity on the incoming Monobactam as compared to the penicillin and the cephalosporin. So that is the important features of the Monobactam. So that is the mechanism how Monobactam actually inhibit the synthesis of the peptidoglycan. So most important Monobactam is the Aztreonam. Okay, so here is the structure of the Aztreonam. Aztreonam, that is the most important Monobactam. So if you see the structures of the Aztreonam, so most important component of this structure, or you can say this antibiotic, is the beta lactam ring. So that's why we called it beta lactam antibiotic. So it has only one ring, so we called monocyclic antibiotic. So it is actually monocyclic because it has only one ring, and that ring is actually the beta lactam ring. Okay, so it actually gives good coverage against the gram negative bacteria. Okay, that is the important features of the Monobactam. It will give the good coverage regarding the gram negative bacteria like the Klebsiella, Pseudomonas. Okay, that is the important features of the monobactam, and it will not give the good coverage for the gram positive, or you can say anaerobes. It will not give the good coverage for the gram positive bacteria and the anaerobes. If we see the route of drug administration, so actually Aztreonam is given through the IV, or you can say IM route, intravenous, or you can say intramuscular route. But important thing which you have to remember, if you see the patient has kidney failure, okay, if there is a patient and that patient has the kidney failure, then due to the failure, renal failure, you will see the accumulations of the drug in the body, because the important route of excretion of the drug is actually the kidney. When there is a problem in the kidney, then you will see the accumulation of the drug inside the body. Okay, so you just have to keep in mind the renal failure in the history of the patient. Next, if we look at the different adverse effects, so most important adverse effects is the skin rash. Skin rash, but generally it is considered non-toxic. Monobactam is considered non-toxic, but these symptoms can happen in certain patients. Okay, you can also see the hepatotoxicity. Hepatotoxicity. In that case, you will see the abnormal LFT test, liver function test will be abnormal by taking the monobactam. Okay, you can also see the phlebitis. Phlebitis, inflammations of the veins, can also happen uh, by taking the monobactams. And you can also see the GIT disturbance like the diarrhea. And you can also see the vertigo, spinning sensation, and you can also see the headache in that case. So these are basically the different adverse effects of the monobactam. And last, most important, is the cross reactivity. So there is no cross reactivity by taking the monobactam as compared to the penicillin, cephalosporin, and the carbapenem, that actually show the cross reactivity because of the difference in the structures of the monobactams from the penicillin, cephalosporin, and the carbapenem. So this is all about the mechanism, different adverse effects of the monobactam. If you still have any question, you may ask in the comment section. Thank you so much.